I'm an obstetrician and gynecologist in Calgary, Alberta, Canada. I'm Chief of Obstetrics and Gynecology at one of the teaching hospitals here in the city. In 2002, I established the Allen Centre, which is a clinic here in Calgary that provides medical and cosmetic services for women in the Calgary area. The Allen Centre provides general obstetrics and gynecology services, but also we have a lot of services that address female cosmetic genital surgery. Vaginal laxity is a major issue for women, and they have been seeking my services at the Allen Centre for the last 10 or more years. I was looking for a less invasive technique to address the issue of vaginal laxity, and I found it with the Viveve treatment. Viveve is a very safe, effective method that involves no downtime. Women can go back to their normal activities immediately, and they see significant and impressive results in reducing vaginal laxity. At the Allen Centre, we try to provide an atmosphere where the women feel comfortable to open up about their sexual concerns and about their physical concerns. The nurses and the physicians at the clinic are all skilled in talking to women and making them feel comfortable that they can tell us their concerns with vaginal laxity and sexual response in general.
We have spoken with hundreds of women on phone, email, or in consultations. They all contact us. They know there's an issue with vaginal laxity and they're seeking solutions. For most women, it starts on the internet. It's a safe place to look for information and discover what options are out there because you remain anonymous. Once people discover that there are options that they may be interested in, our goal is to get them into the office to come for a consultation. That's the best way to hear the concerns firsthand, what's bothering them, and then once they come in to see us, then we're able to give them more information on the procedure and decide if it's right for them. We're very fortunate we have a physician here that's very comfortable to talk to. The women really relate to him and they start to feel comfortable right away. But it's also nice for the nurses to have some alone time with these women. They can chat about their concerns about laxity, but they also open up about their sexual relationships and those concerns and how the laxity affects that. It's really important that you let these women know that they're not alone in these concerns, that it's a common issue for a lot of women, and that a lot of people are seeking this treatment as well. The biggest thing that patients want to know when they come in is, will the procedure be painful? Most patients feel either heat or cold during the procedure, possibly a little bit of tingling, but we've never had any patients say that it's painful. It's always very comfortable. The procedure lasts about 30 minutes and you're able to go right back to normal activities afterwards. You can go right back to work, to the gym. There's no downtime. We just ask that you don't use a tampon or have intercourse for 10 days after the procedure. Some women start to notice results as soon as 2 weeks to a month afterwards, but your best results are seen 3 to 6 months after the treatment. We have data that shows the results do last a minimum of 12 months, but we feel it will last longer for some women. Women who are good candidates for this procedure are those who feel they're experiencing vaginal laxity. For most women, this is after they've had at least one vaginal birth, but there are some women who feel they experience laxity without giving birth, just with the natural decline of aging. We would need you to be premenopausal for the treatment. You're still having periods. We would also need to do a thorough examination first to make sure your anatomy is appropriate for the treatment. There are certain medications your doctor would discuss with you ahead of time to ensure that that is also safe with this treatment. We of course can't treat anyone who is pregnant or breastfeeding or planning to become pregnant right away, and we don't treat anyone who has implanted electrical devices. Most of our patients are very happy with the treatment results. Of course, you do get a wide range. It depends on your expectations, what you're hoping for when you have this procedure, where you're hoping to end up, and also your physical anatomy. Not everybody responds to the treatment the same way. When we're talking with patients a month or 3 months afterwards, you notice a big change. For a lot of women, they say they have increased confidence. Just this gives them an extra boost in their sexual relationships. And they also feel a different kind of closeness with their partner because it's kind of like they're experimenting again. They're trying things out and they're trying to see if there's an improvement there for both of them.